and welcome everybody to the call, or to the interview we could say. On today's call we have a very, let's say, insightful interview for you today. We've got a guy called Stuart Elwell. He's a ex-professional or Premiership football club physio. He's also one of Gray Cook's functional movement practitioners, and we'll expand on what that is in a second. But at the moment, he's left the Premiership Football Club, and he's now working from a private clinic in the West Midlands. You can find him on SE Therapies, which is on Twitter, and his specialist area is groin, pelvis, and low back injury, and also any sort of hernia rehabilitation. So there's just a quick sort of intro to Stuart. What we're going to be talking about on the call is very much about functional exercise and how we can use exercise to not only treat these types of problems in the groin, pelvis and low back area, but also prevent them from happening. Because again, we hear a lot about injury is maybe not so much overcome in its treatment, but more in its prevention. So we're going to be talking and looking at exercise in that way, because we know, obviously, if you're listening to this call, you're going to be involved in exercise in some way, shape or form, and we're going to be looking at how we can prevent injury, or using exercise to prevent injury. So that was my little introduction to Stuart, but what I'd like now is for Stuart, if you'd just like to introduce yourself and just sort of say hello to the listeners, and also could you expand on maybe what a Gray Cook functional movement practitioner, what that is and maybe what it involves?
Thank you, Chris. Thank you for this opportunity to go through this. Yeah, like you say, the role of a functional movement systems expert, as they've termed it, really. The process of functional movement was sort of developed through Gray Cook and his appraisal of movement, really looking at how people move and trying to put a figure on it. Gray coins the phrase of getting a blood pressure check for people's movement, and to try and get a baseline really of what's deemed as being healthy and what's deemed as being a risk of developing problems. So the functional movement systems is a collection of tests, collection of assessments that include a functional movement screen, which is quite popular among athletic trainers in the US and in the UK as well, to screen people's movement and to give people a score really of how well they move. The other additions to the system are the Y balance test, which is a modified star excursion balance test, which really is a way of kind of getting a good appraisal of someone's symmetry and getting a test score, which is body relative, and gives you this left to right symmetrical scoring, both mainly for the lower limb, but also the upper limb is now starting to gain popularity. And then in addition to this, the really sort of icing on the cake for me, for the clinical side of things, is the selective functional movement assessment, which is more of an appraisal of movement, really looking at how people move and really using expected benchmarks, really, of what people should do in terms of general body movements and looking at how they contribute to one another. So the fact that somebody can't flex their neck fully or extend their neck fully, the contribution to overall movement patterns of, say, touching someone's toes or arching back fully, they're very influential. And this the process of going through assessing someone's movement top to bottom to look at where dysfunctions lie in terms of treating someone's pain and dysfunction, it's really sort of quite powerful. Something I use really to appraise someone's whole movement generally. Yeah,
so we're looking at movement in a way to maybe address someone's improper movement. So I'm assuming the improper movement that someone might have is going to lead to an injury, and maybe by finding the dysfunction. So let's say an imbalanced posture, be it the rounding of shoulders or the tilting of a pelvis, or let's say tight hamstrings, or whatever it might be, that's in some way going to lead to an injury if it's not